This solution is used to treat specific forms of cancer such as large B-cell lymphoma, LBCL, and diffuse large B-cell lymphoma, DLBCL. Glofitamab helps to slow down or halt the growth of cancer cells. It is usually administered through intravenous injection as directed by a healthcare professional. The dosage and timing of the treatment will depend on the individual's condition and response to the medication. It is important to follow the doctor's instructions carefully for the best results. Before you start using Columvi 1 mg per milliliter intravenous solution, make sure to read the medication guide and patient information leaflet provided by your pharmacist. Carry the patient wallet card with you at all times and show it to your health care providers. This medication is given by injection into a vein as directed by your doctor, usually over 2 to 4 hours. Your doctor will start this medication at a low dose and gradually increase it to reduce the risk of side effects. You will also be given a single dose of another medication, Intravenous, a week before your first dose of Columvi 1 mg per milliliter intravenous solution. You must stay in the hospital/clinic during and for some time after the first dose so your doctor can monitor you closely and help you manage any side effects. Before you receive this medication, your doctor will prescribe other medications to help prevent side effects and infection. Use this medication regularly to get the most benefit from it. It may help to mark your calendar with a reminder. Some people using this medication may experience tiredness or muscle/joint pain. If these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. While serious side effects are possible, your doctor has prescribed this drug because they believe the benefits outweigh the risks. Close monitoring by your doctor can help reduce the risk of serious side effects. Be sure to contact your doctor immediately if you experience any serious side effects, such as easy bruising/bleeding, signs of anemia, or symptoms of nervous system problems. It's important to note that this medication may lower your ability to fight infections, increasing your risk of getting a serious or worsening infection. If you notice any signs of infection, such as a persistent sore throat, fever, or cough, notify your doctor right away. In some cases, this medication can cause side effects due to the rapid destruction of cancer cells, known as tumor lysis syndrome. To lower this risk, your doctor may prescribe additional medications and advise you to drink plenty of fluids. Additionally, some people may experience a worsening of their symptoms due to tumor flare. Notify your doctor if you experience symptoms such as tender or swollen lymph nodes, chest pain, or trouble breathing. While a rash is a common side effect of this medication, it's important to seek medical help immediately if you develop any rash, as it could be a sign of a severe reaction. Finally, while rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. Glofitamab, also known as Columvi 1 mg per milliliter intravenous solution, is used for the treatment of certain types of cancer. It is given through an intravenous infusion in a hospital or clinic, where your doctor can monitor you for any serious side effects and provide immediate treatment if necessary. If you experience symptoms such as high fever, trouble breathing, chills, dizziness/lightheadedness, or fast heartbeat, it is important to notify your doctor right away. This medication works by engaging the body's T cells to target and destroy cancer cells. The dosage and timing of the infusion will be determined by your healthcare provider based on your specific condition and medical history. Before starting the treatment with Columvi 1 mg per milliliter intravenous solution Antineoplastic, Immunotherapy, T-cell engager, make sure to inform your doctor or pharmacist if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. You should also inform your doctor about your medical history, especially if you have had recent infections or kidney problems. This medication may cause dizziness, drowsiness, or affect your thinking and coordination. It's important to avoid alcohol or marijuana, cannabis, as they can worsen these effects. Avoid driving, using machinery, or any activities that require alertness until you know how this medication affects you. Limit alcoholic beverages and discuss marijuana use with your doctor. Using this medication may increase your risk of getting infections or worsen current infections. It's important to stay away from anyone who has a contagious infection such as chickenpox, COVID-19, measles, or flu. If you have been exposed to an infection, talk to your doctor for more details. Before receiving any immunizations or vaccinations, make sure to inform your healthcare professional that you are using Columvi 1 mg per milliliter intravenous solution Antineoplastic, Immunotherapy, T-cell engager. Avoid contact with people who have recently received live vaccines. If you are pregnant or plan to become pregnant, it's important to discuss this with your doctor before starting this medication. You should not become pregnant while using this medication as it may harm an unborn baby. Your doctor should order a pregnancy test before starting this medication, and you should ask about reliable forms of birth control. If you become pregnant while using this medication, talk to your doctor right away about the risks and benefits. It is not known if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding while using this drug and for some time after the last dose. Understanding how different medications interact with each other is important for your health. Always keep a list of all the medications, including prescription, over-the-counter, and herbal products, that you are currently taking and share it with your doctor and pharmacist. It's important to follow your doctor's instructions and not make any changes to your medication without their approval. If someone has taken too much Columvi 1 mg per milliliter intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center right away for guidance on what to do. U.S. residents can call their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center for assistance. It's important to have lab and medical tests, such as a complete blood count and kidney function, while using this medication. Make sure to keep all medical and lab appointments, and consult your doctor for more details. This medication can be used to treat certain types of cancer and is given through a vein, intravenously. The dosage and frequency of this medication will be determined by your doctor based on your medical condition and response to treatment. It is usually given by a healthcare professional in a hospital or clinic setting. Make sure to take each dose of Columvi 1 mg per milliliter intravenous solution Antineoplastic, Immunotherapy, T-cell engager as prescribed by your doctor. If you happen to miss a dose, be sure to contact your doctor or pharmacist immediately to establish a new dosing schedule. This medication is administered in a hospital or clinic and is not meant to be stored at home. It is used for the treatment of certain types of cancer and works by helping the immune system to kill cancer cells. The dosage and timing of administration will be determined by a healthcare professional based on the individual's specific condition and needs. If you have any concerns or questions about this medication, be sure to discuss them with your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.